Aloha everyone. My name is Greg Fritz. I'm a licensed acupuncturist here in the state of Hawaii. I'm also nationally board certified. I currently work in a military treatment facility. I work in the chronic pain management clinic. When people find out that I use Eastern medicine to find creative solutions to help with people's pain and other health issues, I'm usually greeted with three questions. And I wanted to answer those three questions for you today in reverse order. So the number three question that I get asked most frequently is, can acupuncture fix my, and then you fill in whatever ailment that you want to put in there. And the answer to that is no, it can't. Acupuncture doesn't actually fix anything. I kind of equate it to getting staples or stitches put in. If we get a bad cut, let's say I hit my hand with a chainsaw, for example, and I go to get stitches or staples put in, those don't actually heal the wound. What they do is set up the condition for the body to heal itself. The body was designed and created to heal itself. We know this because cuts heal. But if it's wide enough, we have to bring that tissue together so that the cells can do their thing and form collagen strands and fibers and knit it back together. And so, in the same way, acupuncture needles are inserted into the skin in order to send signals to the body. Chinese medicine basically says that we have too much of something or not enough of something in the body. So what we do then is send signals and tell the body to either get rid of something or produce something. That's what the needles do. That leads to a follow-on question. My number two asked most question is, how does acupuncture work? And while that's a great question, it's one that scientists study because we don't really know the exact answer to that. We know a number of things that happen, a number of mechanisms that go on. For example, there's a great point right here between the eyebrows that when you put a needle in there, there's a nerve bundle that goes back to the pineal gland in the brain, and that tells the brain to release endorphins, enkephalins, endo-opioids, all of these feel-good chemicals. So we know that there's a chemical bath going on in the body. A number of hormones and cells are activated that help to bring about a healing environment. In the 70s, there's a Dr. Song out of China, and she published the first mast cell theory. And mast cells they were initially thought to be strictly for our immune system. But now we find out that mast cells can do a number of different things in our body, and they can actually overact and even cause a disease. But when we insert the needles, those cells are activated, and they change the way that the nerves talk to each other, the signals that go between the neurons. So we are actually affecting nerve level pain receptors and the way that the signals are sent with acupuncture. So Eastern science basically says that if you have pain in the body, there's a stagnation somewhere. Something isn't flowing the way it should. So if we can restore circulation to the body, that will help to get rid of the pain. So that's a very basic view of the mechanism from a Chinese medicine perspective. We're restoring circulation to break stagnation and relieve pain. Western medicine has a whole bunch of different theories, like the chemical bath, electrical charge relay, the way that the nerves speak to each other. So when I say we don't know how acupuncture works, we know a number of the things that it does, but we can't explain why putting a needle in my hand, for example, may help with a headache. We're learning about it. The number one question that I get asked is, does acupuncture hurt? And that's a really hard, difficult question to answer. I would say, no, it doesn't, but it's hard to judge everybody's pain level. For some people it does. And occasionally we will hit maybe a hair follicle or something like that, and that causes a burning sensation. And it's no problem. You say, hey, this doesn't feel good. The acupuncturist will remove the needle or adjust the needle, and it'll go away. Now you will feel a sensation, and we kind of need to differentiate between pain and sensation. Sometimes there's a dull, achy feeling, or a feeling of warmth or coolness, or a feeling of motion, like something flowing across it, water flowing or something. And the Chinese explain this as a traveling sensation. It's actually a good thing because it shows that we hit an active acupuncture point, a point where we know that we're doing something good for the body. Now, different cultures have different ideas. The Chinese believe that if you don't feel a needle going in, then it's not a good acupuncture treatment. The Japanese, on the other hand, traditionally believed that if you feel the needle going in, it's a bad acupuncture treatment. So there's a little bit of variation on how it works, and that is part of the beauty of acupuncture, is that there's a little bit out there for everybody. It's all achieving the same result and all patient-oriented, but there's a little bit different methodology between different acupuncturists, and that's not a bad thing. The last thing I'd like to talk about a little bit is our needle size. We have very, very small, tiny gauge needles. It's about a 32 gauge by Western medicine's measurements. It's a 0.20 to 0.25, somewhere in that ballpark, maybe a 0.3 millimeter. So very tiny needles. We can fit about 40 of them into a needle that you think of when you get an injection, like a flu shot or something. So they're tiny. They're also cut to a point, so they're designed to push tissue aside. The needles that we use for injection or drawing blood are cut at an angle, and they have a hole in them. So they're actually designed to tear tissue apart so that we can either inject something in or pull it out. So hopefully I answered a few of the questions that you have when it comes to acupuncture and its benefits, how it works, and does it hurt? I may not have given exactly the answers you were hoping for, but acupuncture can most likely benefit you in some way in your life. Check out your local acupuncturist.